Today we are talking about postpartum depression. We have Ashley, Bailey, Jen, Kim, and Tracy. Today we will be covering postpartum depression statistics, what is postpartum depression, the epidemiology and demographics, signs and symptoms, impacting factors, nursing care, nursing assessments and interventions, and community resources. Before we get into the thick of things, let's take a look at some unnerving statistics. According to Duat et al., postpartum depression affects up to 13% of new mothers. Perinatal Services BC states that postpartum depression also occurs in up to 10% of men. The Canadian Association of Mental Health states that there is a 40% chance of recurrence with future pregnancies. The RNAO, Best Practice Guideline on Perinatal Depression, warns that death by suicide in the perinatal period occurs in up to 11 out of 100,000 births. This results in a more common cause of death versus either postpartum hemorrhage or hypertensive disorders in pregnancy. Finally, according to postpartumdepression.org, 50% of women with postpartum depression sadly go undiagnosed. Now let's take a look at what postpartum depression is. According to Keen and Lindsay, postpartum depression is a depressive illness that usually manifests within 2 to 4 weeks after birth, although it can occur during pregnancy. This illness is much more significant than baby blues, lasting much longer and requires treatment. The RNAO Best Practice Guideline describes the experience of emotions such as anxiety, feeling overwhelmed, isolation, and guilt. A sense of significant loss may be experienced, including loss of self, control, relationships with others, and voice.
A study from 2018-2019 found that 23% of new mothers in Canada reported feelings consistent with either postpartum depression or an anxiety disorder. These findings varied across provinces, ranging from 16% in Saskatchewan to 31% in Nova Scotia. The proportion of mothers under the age of 25 was higher by 30% than all other age groups. Studies have also shown that 31% of new mothers diagnosed with PPD have previously been told by a health professional that they had depression or a mood disorder prior to being pregnant. Some of the signs and symptoms for postpartum depression are mood swings, disinterest in others, loss of normal give and take in relationships, intense feelings of inadequacy or unworthiness, guilt, and an inability to cope, loss of mental concentration, inability to make decisions. Other signs and symptoms are anger and irritability, trouble sleeping and or a change in appetite, constant fatigue and feelings of ill health, excessive crying or difficulty managing activities of daily living, moderate to severe depression, and the inability to bond with their new baby.
There are many factors that can have an impact on developing postpartum depression. Some of genetics, having a family history of postpartum depression increases the risk of developing it yourself. If you previously have suffered from depression or bipolar disorder, this will increase your chance of developing postpartum depression. Environmental, women who live in cities tend to have lower social supports and increase the chance of postpartum depression. Emotional, many women will have stresses about having a child. These stressors can include thoughts of being isolated because you're feeling less social than before your baby, feelings that you have no time for yourself. You may not have the support you need from your partner, family, or friends. There may also be thoughts of financial strain because you're no longer working. Physical changes happen to a woman's body when she is pregnant. Not only does the appearance change, but there are also hormonal changes, decreased levels of estrogen and progesterone within the body. Another physical factor is the lack of sleep that occurs after childbirth, which can impact how situations are handled, the functions of the women, and the feelings that the women has. In some women, these changes increase the chance of developing postpartum depression. Psychosocial. These factors can include having an unwanted pregnancy, being a single parent, having addictions to alcohol or drugs, and having to change or stop taking certain medications. Some risk factors have shown to have a greater impact on whether you will develop postpartum depression. There are strong risk factors that can include having a history of mental concerns or developing prenatal symptoms of depression. Some moderate risk factors include stressful life events, such as losing a loved one, having low or lack of social support from family or friends, and if there has been a history of abuse, emotional abuse, or physical abuse, especially if you are a victim of partner violence, if there is a history of substance use, such as alcohol or illegal drugs. Some weaker risk factors include having a low socioeconomic status, and if you find yourself being a lone parent with an unplanned or unwanted pregnancy, and if you're experiencing any breastfeeding challenges that leave you feeling frustrated, lack of sleep can also be a risk factor.
Quick question. Which of the following is not a sign or symptom of postpartum depression? Excessive crying, lack of enjoyment, abundance of energy, or loss of appetite? The answer is C, abundance of energy.
Sharma and Sharma state depression during the postpartum period is classified as major depressive disorder with postpartum onset. A diagnosis of a major depressive episode requires that at least 5 of the symptoms previously discussed must be present, of which must be either depressed mood or diminished pleasure or interest in activities. The symptoms must be present most of the day, nearly every day, for 2 weeks, and there must be an associated decline in social and or occupational functioning. A depressed mood caused by substances, such as drugs, alcohol, or medication, or which is part of a general medical condition, is not considered towards a official diagnosis of major depressive episode. Let's talk about treatment.
Starting off, pharmacological treatment of postpartum depression. Antidepressants such as SSRIs and SNRIs are commonly used in the treatment of PPD. Zoloft and Paxil are 2 commonly used first-line medications. These can be used with breastfeeding mothers as the exposure of these drugs in breast milk is very low. After delivery, women experience a drastic drop in estrogen and progesterone hormone levels, and this shift has been identified as one trigger for the onset of PPD. By using hormone replacement therapy, it has been shown that the symptoms of PPD can decrease. Lastly, prophylactic treatment, aka preventative measures, are used in women who have previously struggled with postpartum depression in previous pregnancies. Some treatment options include the use of antidepressants soon after delivery, as well as other non-pharmacological treatment options, which we'll get into in a moment. Now we'll talk about some non-pharmacological treatments of postpartum depression. Things such as music therapy, alternative medicine such as massage therapy, physiotherapy, chiropractics, and acupuncture. These have all been used to decrease symptoms of postpartum depression and to promote overall wellness in postpartum moms. We can also use mindfulness techniques such as meditation, journaling, breathwork, and yoga, and exercise such as walking, jogging, weightlifting, swimming, and recreational sports. Lastly, we can use psychological and psychosocial interventions such as cognitive behavioral therapy, interpersonal psychotherapy, and peer support groups. Quick question. Medications prescribed for postpartum depression are safe for breastfeeding mothers. True or false? The answer is true. Moving on to the nursing assessments for postpartum depression. These assessments include continuous assessment of psychological health at all prenatal visits leading up to birth and after, assessing for history of mental illness, and screening tools such as the Edinburgh Postnatal Depression Scale and the Postpartum Depression Screening Scale. The Edinburgh Postnatal Depression Scale is a set of 10 screening questions that can indicate whether a parent has common symptoms of depression and anxiety during pregnancy and in the year following the birth of a child. The Postpartum Depression Screening Scale is a 35-item self-report instrument that can be administered in 5 to 10 minutes. It identifies women who are at high risk for PPD so that they can be referred for definitive diagnosis and treatment.
Nursing interventions. The nurse's role regarding postpartum disorder focuses on supporting the mother and the family as well as providing education. As a nurse, the priority is focusing on the mental health needs of the postpartum mother by facilitating support professionally and from community resources. The nurse can also provide support by ensuring the mother's immediate family and friends are involved as part of the support system. Involving those family members as well as friends can provide the additional support the mother needs. Educating those affected by postpartum depression about the benefits of self-care activities allows for time to rest as well as increases the level of energy that is beneficial from relaxation and proper sleep hygiene. Other interventions include providing supportive weekly interactions and ongoing assessments focusing on mental health needs of postpartum mothers experiencing depressive symptoms. Facilitating opportunities for the provision of peer support for postpartum mothers with depressive symptoms. Also promoting self-care activities among new mothers to assist in alleviating depressive symptoms during the postpartum period. Lastly, consulting appropriate resources for current and accurate information before educating mothers with depressive symptoms about psychotropic medications.
There are many community health resources within our area. On this slide, you will find a few. One being the Simcoe Muskoka Public Health Unit. They do offer a phone line information provided to the public, which is staffed by health professionals. They are available to you and provide resources on postpartum mood disorders, postpartum health, breastfeeding, and general parenting questions. Another is the CMHA Simcoe County Peer Support Group. They offer an after baby group and also have several Indigenous groups, mainly in the Aurelia area. A third is one called Mother Matters. It is an 8-week online support group run by the Mental Health Program Unit at Women's College Hospital. You must have availability to computer in order to take part in this. And the final one I've highlighted here is North Simcoe Muskoka Walk-In Counseling Clinic. They provide walk-in appointments and provide a single session counseling. The importance of treating postpartum depression for the nursing profession. It's important that we work proactively to identify postpartum depression. It's the best practice for nurses as it prioritizes the health of both mommy and baby before more significant issues can develop. It's important for the nurse to assess for any potential postpartum depression signs before discharging the patient home and to educate the family, not just mommy, on available resources. According to Keenan Lindsay, the treatment of PPD can assist in preventing issues such as infantile abuse, neglect, and psychosis.
We have a few final questions to wrap up our day. Number 1, how long does postpartum depression generally last for? A, 3 to 6 months, B, 1 to 2 weeks, or C, 6 to 12 months? The answer is A. Number 2, antipsychotics are the first choice of medications to treat postpartum depression. True or false? The answer is false. Number 3, what medications are used to treat postpartum depression? A, analgesics, B, antipsychotics, or C, antidepressants? The answer is C, antidepressants.
And this concludes our presentation on postpartum depression. As postpartum depression can affect many women. If you feel this is happening to you or know someone that needs help with it, please contact your physician, seek counseling or someone to talk to by reaching out and using your local resources. And finally, find time for you. Self-care is important at all times, but especially after having a baby. Try and find the time to spend on activities you enjoy, find relaxation strategies that work for you, and spend time with friends and family who support you and help you make you feel good.